Welcome to the deep dive. We try to cut through the noise and get you informed fast. And today, well, we've got a really fascinating topic lined up. We're diving into a field that's just, well, it's exploding. Artificial intelligence, machine learning in health and medicine.
Yeah, absolutely exploding. And our source for this deep dive is particularly insightful. It's this comprehensive 25-year bibliometric analysis, basically looking at all the research published on AI and ML in health and medicine.
Wow, 25 years.
Exactly. It was published in Healthcare 2025,
Yeah.
and it gives this fantastic global sort of historical picture right from 2000 up to 2024.
Okay, so our mission today is pretty clear then. We're going to unpack the really important bits from this huge study. We'll look at the key trends and try to connect it all back to what it means for healthcare's future and, importantly, for you listening.
Sounds good.
Right, so let's start with just the sheer scale, the volume you mentioned. It sounds astounding. Over 22,000 research articles.
It is, over 22,000. But what's really fascinating, I think, isn't just the number, it's the pace, especially with citations.
Ah, right, so how people are using the research.
Exactly. Publications increased steadily, sure, but the citations just went exponential. They really, really accelerated from about 2015 onwards.
2015, any idea why then?
Well, it suggests a real breakthrough moment, probably driven by advances in deep learning becoming more powerful, maybe more accessible computing power, too. The total citations hit over 546,000. That shows, massive recognition, real impact.
So, okay, it's not just academics writing papers. There's huge attention here, foundational work that's genuinely shaking things up. Speaking of impact, who's leading the charge? Which countries, which institutions are the big players?
Well, the analysis points clearly to the United States, China, and India. They're the top three, both in terms of how much research they publish and how often it gets cited.
Okay, U.S., China, India.
Yep. And the U.S. Seems to play a pretty big role in global collaboration, too. Lots of partnerships with India, with the U.K. That kind of international teamwork is really vital, right, for moving things forward quickly.
Makes sense. And institutionally, like universities or research centers.
Harvard Medical School comes out on top as the most productive. And interestingly, right behind them is the Ministry of Education of the People's Republic of China.
Oh, interesting. So top academic institutions, but also major government bodies pushing this forward.
Precisely, it highlights these key hubs of innovation and the importance of, well, funding and national strategy, too.
Okay, so we've got the who and the how much. Let's get into the what. What are researchers actually focusing on? What are the hot topics inside this huge field?
Right. The study flags deep learning, convolutional neural networks, and classification as sort of the dominant themes.
Can you break those down a bit in healthcare terms?
Sure. So deep learning, that lets AI learn complex patterns from enormous amounts of data, almost like a human brain might. Convolutional neural networks, or CNNs, they're a type of deep learning especially good with images. That's why they're huge in medical imaging, helping make diagnoses.
Okay, images and classification.
Classification is basically AI sorting things. Is this tissue healthy or diseased? Which risk group does this patient fall into based on their data? That kind of thing.
Got it. And where are these tools being applied most? Specific diseases.
Yeah, the big application areas are definitely medical imaging, as I mentioned, also disease prediction and diagnosis more broadly, and using AI to analyze electronic health records, EHRs, finding patterns in patient histories. As for specific diseases, you see a lot of work on Alzheimer's, Parkinson's, COVID-19, obviously, and diabetes, areas where recognizing patterns early or predicting outcomes is crucial.
That gives a really clear picture of the current landscape. But what's next? What's just starting to emerge? The next wave of research?
Good question. We're seeing a definite rise in things like explainable AI or XAI.
Explainable AI.
Yeah, making the AI's decisions transparent so doctors can actually understand why the AI reached a certain conclusion. That's vital for trust. Also, natural language processing, NLP, in healthcare, helping AI understand doctors' notes, patient interviews, that sort of unstructured text.
Right, understanding human language.
Exactly. And finally, AI in precision medicine and biomarker discovery. That's all about tailoring treatments to the individual, their genes, their lifestyle, and finding new biological signs, biomarkers for diseases earlier. These trends really point towards more sophisticated AI, more nuanced, more integrated into actual care.
Okay, so putting this all together, this research explosion, what's the bottom line for our listener? For you, what does it mean for healthcare?
Well, directly it translates into better patient care. That's the goal. Think more accurate diagnoses, maybe caught much earlier. Like AI spotting tiny signs of disease on a scan years before a human eye might. Or truly personalized treatment plans, optimizing drug doses based on your specific profile.
So it's helping tackle some big healthcare challenges. System strain, need for better quality.
Absolutely. It's tackling system strain, pushing for higher quality, more individual care. It really points towards a future where we manage disease more proactively and hopefully see much better patient outcomes.
It's genuinely incredible how fast this is moving. But it does raise a big question for me. As these amazing AI tools get developed, how do we actually get them smoothly into the complex world of hospitals and clinics? It's not just about the tech itself, is it? It's making it work practically, ethically, transparently
Yeah.
for everyone.
That's absolutely right. Integration, ethics, access. That's the next huge hurdle, a crucial thought.
Indeed. Something to keep thinking about. Thank you for joining us on this deep dive today.